You'll be ready to go home and be reunited with your family once you are medically stable, eating a satisfactory amount of food, and can take care of your daily needs. Your physician, nurse practitioner, or physician assistant will review all discharge information with you and your caregiver before you leave the hospital. This is to make sure you fully understand the importance of your home care responsibilities and the significance of maintaining your post-transplant health. To help you with the transition, it is best if you plan your discharge before you leave the hospital. For example, you may want to make arrangements for someone to thoroughly clean your home 1 to 2 weeks before you are discharged. Have all floors mopped, windows cleaned, and draperies washed if possible. Make sure every room has been dusted well, and kitchens and bathrooms need to be disinfected. Clean any furniture that is fabric or leather if it doesn't look clean. For your health, we recommend you have all carpeting clean and dry before your arrival home. Someone clean the inside of your car you will be using for most of your transportation needs. Dogs and cats may remain in your home after your stem cell transplant. Birds, rodents, reptiles, or other exotic animals are not allowed. The day you are discharged from the hospital may be an exciting time as well as an anxious time. Even though you have been counting the days till discharge, now that it is time to go home, you may be frightened to lose the safety net of the hospital staff who have been there to help with your every medical need. After discharge, there are some restrictions regarding your diet. Your dietitian will provide you and your caregiver with details regarding grocery shopping concerns, specific foods you can and cannot eat, food preparation. You and your caregiver should be especially careful to always wash your hands before handling your medications or food. Once you are home, we strongly recommend that a family member or friend be with you at all times for 4 to 8 weeks immediately following your bone marrow transplant. This will help you in your recovery, as you may be tired and weak. Until your immune system fully recovers, you will need to take certain precautions to protect yourself from infections. In most cases, this will be about 90 days for autologous patients and 1 year for allogeneic patients. Your physician will tell you when your immune system has recovered. These precautions will go a long way to keeping you healthy. One of the simplest but most effective way is again to wash your hands. Washing your hands frequently is the most overlooked yet easiest form of infection control. Have soap at every sink. Ordinary soap in a pump dispenser is fine. When away from your home, you and your caregiver should always carry a hand sanitizer with you. It is important that you avoid shaking hands, being in crowds, and staying in rooms with sick people, especially those with fevers, colds, or flu symptoms. You will be required to follow up with your BMT physician, nurse practitioner, or physician assistant several times a week after discharge to monitor your blood counts, infection status, and recovery. You will need to see a BMT pharmacist who will review your medications with you. To help you experience a more successful recovery, you will also need to take your temperature every morning and evening while your central catheter line remains in place, your white count is below normal, or if your physician tells you to continue taking it. Call your physician if your temperature is 100.4 degrees Fahrenheit or higher. Never take any medication, supplement, or herbal remedy, whether prescribed by another physician or purchased over the counter, without contacting your transplant team first. Limit the number of visitors to 2 or 3 at a time during the first 100 days after your transplant. You should not have any visitors who are feeling sick, or close to someone who was sick, or who has a disease they could give to you. It is important that you notify your BMT physician, nurse practitioner, or physician assistant if you are exposed. Other reasons to call us on the BMT pager are if you have chills with or without fever, suddenly feel bad even without a fever, see any change in the area of your central line, such as redness, drainage, or tenderness, feel pain when urinating or change in color of urine, have difficulty swallowing, are exposed to someone within 3 days of them developing chickenpox, have diarrhea that lasts for more than 2 days or have 3 or more stools a day, cannot keep your medications down because of nausea and vomiting, or show any signs of bleeding such as black or bloody stools, bleeding gums, bloody urine, bloody or coffee ground vomit, nosebleed, or excessive bleeding. Carefully following these instructions is important to achieving and maintaining a long-term quality of life. It is also important that you do not skip a dose or change in any way the prescribed amount of medicine you are to take, unless your physician tells you to. If you realize you've missed a dose, you must call your coordinator immediately. Do not decide what to do on your own. It is important for the first 90 days for autologous patients and the first year for allogeneic patients that you avoid being in crowded areas such as movies, malls, schools, and places of worship. Remodeling and construction areas or dusty places. House cleaning that exposes you to dust, such as vacuuming or dusting. Light housework such as dishwashing or ironing is fine. Eating food from sidewalk vendors and restaurants including delicatessens, smorgasbords, buffets, salad bars, fast food places, or carry-out. Participating in direct care duties, for example, changing diapers. Driving after a transplant until you are strong enough. Pumping gas or fixing cars. Working with solvents such as bleach or ammonia, or exposing yourself to paint fumes. You need to avoid travel during this time since you would need to use public bathrooms, eat at restaurants, stay at hotels, or fly in an airplane. All of these are unclean places for a transplant patient. The other concern is that if you get sick, you may not be near a medical center familiar with bone marrow transplant. Please talk to your BMT team if you absolutely need to travel. You cannot go hunting, fishing, camping, or hiking unless your physician gives you the okay to go. Although you can have a cat or dog, you cannot clean the litter boxes or pick up any dog feces, or kiss and hug your animals or allow them to get on your furniture, bedding, or sleep with you. Do not get close to or touch any farm or outdoor animals. Avoid any lifting and all strenuous physical activities until your physician tells you it is okay to increase your level of activity. No live plants or trees should be in the home for 100 days or until you are off all immunosuppressive drugs. You should not do any gardening or yard work, including lawn mowing. Do not swim in public pools or lakes, or use hot tubs or jacuzzis. These can be major sources of infection. If you want to swim in a private pool, make sure it has been properly maintained and chemical levels are checked before use. It is important to always wear a hat, sunscreen of SPF 25 or higher, and not stay out in the sun too long. Generally, sexual activity is considered safe as long as both you and your long-term partner are healthy, keep good hygiene, and have no sexually transmitted diseases, and you have a platelet count above 50,000 and white count above 1,000. It is strongly recommended that a condom be used. Avoid work and school for at least 3 months after an autologous BMT or 1 year after an allogeneic BMT. The time you take off depends on several things, such as if you have an infection, what your overall health is like, or what kind of work you do and how tired you could get from doing your job. As you resume your regular activities at home, you may have mixed feelings about being in the world and facing people. You may find yourself looking at your relationships with family and friends in a new way. The members of the BMT team will be available to support you after your bone marrow transplant and are able to talk to you about any medical or other issues which are bothering you. You may find that returning to work part-time at first makes the transition easier.